Good afternoon, everyone. This is Jonathan Edelheit, president of the Healthcare Reform Center and Policy Institute. I appreciate everyone coming on the call at the kind of at the last minute. The 2000 election results are in, and I think the question on everybody's mind is, what does this mean for the future of healthcare reform in the ACA? I have a co-presenter on with me today, Ben Connolly, one of the advisors and on the board of directors for the Healthcare Reform Center and Policy Institute with Saiparth Shah, one of our top experts and one of the instructors for our Certified Healthcare Reform Specialist program. And, right after the election happened, I think some people felt Trump would win. Some were very surprised by the results. But, either way, we have to focus on the future and what's ahead for us. And so we wanted to discuss for, all our students who have gone through our CRISP program, what's going to happen over the next couple months in the next year. So I'm going to run through some very brief slides, and then I'm going to turn it over to Ben Connolly to present, the view of what it means from the legal side. So obviously, most of you know, for those of you that Donald Trump won president, as the Healthcare Reform Center and Policy Institute, we really try to stay independent, unbiased, bipartisan, don't really take any views on the law, who's passing the law, political parties, anything like that. We just focus on providing the education of what does it really mean, what are good parts of the law, bad parts, ugly parts, how do you need to comply, and what do you need to stay on top of? That's what we focus on. So you've heard from President-elect Trump, things from, potentially completely repealing Obamacare to modifying the existing law. So we won't know until the next few months what exactly is going to happen. Is the Affordable Care Act going to get completely repealed? Or is it just going to get modified and some parts of it will stay the same, some parts of it will change? And Ben Connolly is going to go into a little bit, some of the challenges with, modifying or actually trying to repeal the law. So I think that, the important thing is we don't get caught up in any, political talk, election talk, whether it's from the Democratic or Republican side. We just stay with the facts because we need to conduct our business based upon what's going to change. So some of the core points of what Trump wanted to do with healthcare reform is the first point was to allow individuals to fully deduct their health insurance payments. The second point was to allow individuals to use health savings account and really try to expand them. And really try to eliminate any penalties with that and provide more flexibility with health savings accounts. Requiring price transparency, I think that's a very good positive. There's private companies who do it already, but requiring healthcare providers, hospitals, clinics, doctors, so people can really shop. One of the challenges with price transparency is it going to be price transparency and quality and outcome transparency, and not just price transparency. Part of his proposal is to block grant Medicaid to the states. And another area which will be very interesting because he wants to remove barriers to entry into free markets for drug providers. And of course, there is talk about removal of, having free market barriers where you can even potentially eliminate departments' insurance and state lines with health insurance or health care. And that could be very disruptive and, and chaotic. So really, that's how everything's been regulated since we remember it. If it's deregulated, who's now regulating and how does it happen? How do you, what happens with the agent's role in a deregulated market with no state lines? What happens to the carriers? So it's definitely, I think, the next couple of years are going to be very interesting. I think it can be difficult to just repeal or even modify the law in a very short period of time. But the Republicans do have a majority in Congress, but there are some complications with it. The one thing I would like to say is, the Healthcare Reform Center and Policy Institute, we were here back in 2010 taking a position on the Affordable Care Act before the law was even passed, before CNN, Fox News, any of the news agencies were actually addressing the law. We were telling people what it really means, who it's going to affect. We were the first ones in the industry to tell agents they were going to lose their commission. So I think the key piece with the healthcare reform law, whether it's Obama's or under Trump, is going to be even if the law hasn't been passed, you need to stay on top of any proposed laws, any proposed regulations, everything of it, so that you're following it the entire way, that you can guide your clients through the entire process. Because you're going to have clients asking you today, tomorrow, what does this mean? They're going to be asking you a month from now. So unless you have those answers on a day-to-day basis or any major changes happen, you're not going to be able to have intelligent conversations with your clients. So, you know, the CRISP program, Certified Healthcare Reform Specialist, is going to be here to stay. That CRISP program will be the same program it was under Obama that it's going to be under Trump, whether it's staying with the existing law, whether the law is modified, or Trump puts in a new law. That designation will still be the Certified Healthcare Reform Specialist. So with that, I would like to turn the conversation over to Ben Connolly to really present his perspective on everything.
Thank you, John. I appreciate it. And it's been certainly an interesting 12 to 24 hours. One of the things I was sharing with John before the call is that I spent my morning trying to figure out what all this means because you know, I don't think by any stretch of the imagination this result in its specific form down to the congressional level was, you know, predicted with any level of certainty by any prognosticators. That said, we've had a chance to kind of review a few things. By the way, not even predicted by Congress from what I can tell, because one of the things I was reviewing was Paul Ryan, House Majority Leader's proposal, and his proposal was essentially caveated that he didn't think it was ever going to pass, so they hadn't put a lot of effort into developing the specifics of the proposal. So even within the Republican Party, there's got to be some level of surprise today that the Republicans are now in a position to finally sort of move forward on healthcare reform with their proposals. So with that said, let's talk about a couple things. The question that I'm getting the most from folks is, what does this mean? Can Republicans actually repeal the Affordable Care Act now? The short answer is no. Republicans still do not have a filibuster-proof majority in Congress that would allow them to repeal and replace, as has been the mantra both from Donald Trump as well as the Republican Party along the way. That would require a 60-vote supermajority in Congress, and even if you get a few folks across the aisle from the Democratic Party, it looks like the Republicans are only going to have between 52 and 53 Senate seats. So repeal and replace in and of itself, I don't think is feasible, at least not at this stage, even with both houses of Congress and the presidency under control. Now, that said, there are still two potential steps that the Republican Congress and notably Donald Trump can take unilaterally without Democratic support to really take some steps to undercut the effectiveness of and water down the Affordable Care Act. And the reason why is as follows. Number one, with a congressional majority, the Republicans have the ability to control the spend on the Affordable Care Act. And the Affordable Care Act can't operate without federal tax dollars flowing in to fund, you know, the marketplaces, IRS investigatory efforts, DOL investigatory efforts, and a number of those kinds of things. So, among other things, Congress has the ability to direct the flow of those dollars. Number two, you may recall way back in 2010 when this law passed. And what had happened at the time was the Democrats had a supermajority in Congress. They did have a filibuster-proof majority in the Senate, and both the House and the Senate passed their own version of health care reform, but they were slightly different. They were hashing out the differences, trying to get all the policyholders and influencers on board, and then Senator Ted Kennedy passed away, and his seat was up for a special election, and immediately became apparent that, well, number one, that took the Democrats below 60 votes, and number two, it became apparent that that seat was going to go Republican. And realizing that they no longer had the ability to pass something unilaterally, the Democrats did something that was a bit unprecedented, called using the reconciliation process. And what the reconciliation process allows you to do is to make modifications to the law or pass the law through funding mechanisms, which are specifically the tax provisions under the law. So it appears that Republicans have the ability to, based on this prior roadmap that was kind of laid by the democratically controlled Congress, to repeal portions of the Affordable Care Act, and specifically portions of the law that relate to the tax provisions of the law. And, you know, those are the biggies, right? That's the employer mandate, the individual mandate, and the tax credits that are available on the marketplace. The question remains, but that does not extend to some of the other design-based provisions of the law, like the ban on pre-existing condition exclusions and the adult child coverage mandate. So the question remains, number one, do the Republicans in Congress and does President Trump or President-elect Trump have the inclination to take those steps? And number two, would they be willing to do so considering the potential downstream consequences? And what I mean by that is that estimates are that a repeal of the law entirely would result in loss of health insurance coverage for 20 million people. And you're even seeing Republican members of Congress come out at this point and say, it's not our intent to drop health insurance for 20 million people. We're going to come up with some sort of fix. So what you might see is some sort of hybrid approach. And what I mean by that is it appears that back in early 2016, Congress passed a repeal of the Affordable Care Act that was vetoed by Obama. But if you look at the underlings of that proposal, what that included was a poison pill of sorts. And what I mean by that is that Congress passed a law that was then repealed, but that could be picked up and attempted to be repassed, that would include a delayed repeal of the tax credits under the marketplace, sort of a 2-year time frame during which the tax credits would be grandfathered in, and after that point they would be repealed in its entirety. And what that approach would allow the Republican Congress and presidency to do is to force the Democrats to come to the table and negotiate a broader sort of repeal and replace initiative based on the presumption that if 2 years run past and nothing happens, the tax credits go away and 20 million people lose health insurance coverage. Now, that's a politically dicey move in and of itself, because what would end up happening 2 years from now, and we saw this play out back in 2010, 2012, is that both sides would start pointing fingers and saying, well, it's not our fault that this law went away, it's the other side's fault. The Democrats arguing the Republicans started the ball rolling. The Republicans arguing that the Democrats had the opportunity to replace this with something else but chose not to do so because they were being obstructionist. So there's sort of the technical legal aspect of, is there the possibility that this law will now be repealed? And I think the answer is yes, at least in part. All the pieces are in place now that if the Republican-held Congress wanted to repeal the law, they could, and there would no longer be that veto threat. The more practical political reality is that it's a more complicated discussion, I think, and it's too early to predict. Second thing I want to say, and I know that first thing rambled on for quite a period of time, is sort of a prognostication of what we might see in lieu of the Affordable Care Act, because again, the Republicans' platform is not just repeal, but repeal and replace. And what you see in that respect is sort of an interesting cobbled together hybrid of various provisions of the Affordable Care Act that did exist previously, as well as some of the new proposals that John was discussing at the outset of the presentation. But notably, the Republicans in Congress, and I'm talking specifically about Paul Ryan's health care proposal, would include retaining some of the most popular provisions of the Affordable Care Act, like the ban on pre-existing condition exclusions, the ban on insurance companies rescinding coverage, adult child coverage, some of the wellness incentive provisions under the law, while jettisoning some of the other wellness incentives under the law. And the list kind of goes on, but those are some of the big ones. And so, I think that what you're going to see is, even if it is technically a repeal and replace, a lot of those replacement elements will be very, very similar to the elements that were in the law that had just been repealed. So I don't think by any stretch of the imagination you're going to see us revert to ground zero where there was nothing at all in place prior to the Affordable Care Act. Some of these elements are likely to be retained. Now, the challenge that Republicans in Congress are going to face, and you saw this morning when many health insurance carrier stocks dropped precipitously right out of the gate, is that a ban on pre-existing condition exclusions in and of itself can lead to what is called the so-called death spiral. Because that incentivizes people to wait until they get sick to buy health insurance coverage, and that is not a sustainable process. The Affordable Care Act's attempt to moderate that in some way was the individual mandate. A lot of people criticize the individual mandate as not being effective at driving people into the marketplace, healthy lives into the marketplace. The Republican proposal seems to be, from what I can tell, harkening back to the HIPAA guidelines in the 1990s that applied to employer-sponsored plans but not to the individual marketplace, where you would have the ability to always get another insurance policy, but only if you're coming off of an existing insurance policy. In other words, as long as you don't allow a gap in coverage to arise, you always have the ability to roll over from one insurance policy to the next without imposition of pre-existing condition exclusions. And then, if you do have a gap in coverage for whatever the reason, the Republican proposal appears to be suggesting a resurgence of what we would call state high-risk pools, where individuals who are otherwise uninsurable would have an avenue to go to get health insurance. Those state high-risk pools had some mixed success. They often ran out of funds, and the problem that you run into in that context is you have a health plan covering only sick individuals, so it becomes prohibitively expensive without those healthy premiums offsetting that cost. So whether that ends up being the final proposal, that was all part of the Paul Ryan proposal. The Trump proposal to date haven't really hit on those elements. So it remains to be seen what the final package is going to look like, but all we're really doing at this point is speculating. We have not seen anything comprehensive that we could suggest, well, this is where things are going to end up. So those are the two pieces I wanted to hit on today. Number one, the likelihood of repeal, and then number two, what you could see fill the gap post-Affordable Care Act. And everything else is pretty much anybody else's guess at this point because this is all a bit uncertain.
Well stated, Ben. Thank you so much. Got a couple questions for you. Some questions are coming in. The first question is, how long do you think, with the different variations of what could happen, repeal and replace, modify, just keep, how long do you think this period could take? Like, even if it's you were talking about, them repealing it and getting a super majority, are we talking, a month, 2 months? Are we talking a year, 2 years, 3 years? What are the possibilities?
Great question. So the overall repeal and replace, I think, would be a much longer process. The reasons why are many. First, you'd have to negotiate with the other side to come up with some sort of comprehensive package that all parties agree on, and that's just not going to materialize overnight. Number two, if you're passing a new law, that then subjects it to Congressional Budget Office scoring, the regulatory process, which involves, proposed commentary or proposed regulations, followed by a notice and comment period, followed by final regulations. And that process in and of itself could take at least a year. If you're looking at repeal of some of the specific elements, first, the new members of Congress, so Congress currently holds a majority, but Trump won't be sworn in into presidency until January. But the timing of that process, I don't think is as important as the structure of that process, because if you look at some of the proposals from Congress that came out that were previously vetoed by President Obama, they would have involved a retroactive reduction of penalties under the employer mandate, retroactive to the effective date of the employer mandate. So that proposal would have been in 2016, that would have retroactively removed the penalties all the way back to the beginning of 2015, meaning even if you're in violation of that law, the IRS has no authority, statutory authority to assess a penalty against you. Could this all go away immediately? I don't think so. I don't think you're going to see that happen on January 8th. But could it effectively go away with a retroactive date? At least some pieces of it, potentially, yes.
And with that, what is the longest period you think this could potentially take?
Well, that's a really good question, too. I mean, so an important point here is that never in the history of Congress has Congress repealed an entitlement program. And what I'm talking about here is primarily Social Security, Medicare, and Medicaid. And that's what you're effectively proposing here if you're talking about getting rid of the exchanges and the marketplace tax credits. So the problem the Republican Party is going to face at this stage is getting their own buy-in from their own stakeholders. Certainly, if you want to throw out the red meat and say we're going to repeal the Affordable Care Act, that in and of itself is always going to get a huge applause line, you know, at a Donald Trump rally. That being said, when you get down to the core constituency and you're talking about 20 million people, clearly if this election ultimately is decided based on 200,000 votes, which looks like the differential in the popular vote right now, a 20 million vote swing, even if you only assume that half of those people who are losing coverage, you know, are Republicans to begin with, and only half of those would change their vote as a result, that's still more than enough to tip the scales. So, you know, there is a possibility that Congress never gets behind an effort to fully repeal this, at least not in the form that has been proposed.
And for those people on our webcast who really don't understand what a supermajority means, you know, and think it's just very easy, you know, just Republicans beat out Democrats by number of votes to get something done. What does that supermajority mean, and how difficult is that?
Yeah, well, so, you know, in order to avoid a filibuster in the Senate, and filibuster obviously meaning the ability of one senator from an opposing party to stand up and talk indefinitely and effectively kill a bill, either political party needs a 60-vote majority. So, again, it looks like the Republicans will have a 52 or 53 vote majority, so they're clearly short of that 60 necessary votes. There's certainly a possibility, and in an earlier political era, a likelihood that, you know, some Democratic senators would come across the aisle and work with Republicans to, you know, pass something comprehensively and put them over that 60-vote threshold. But this is a different political environment. I mean, I think we all saw that last night. It's a very divided nation, and parties are just as beholden to their own base as they are to the general electorate. And so finding 7 votes, or, you know, 8 votes to reach that supermajority might be a challenge.
What do you say from, you know, it could be agents or brokers who, you know, because we've gotten some emails from some, you know, where they were Trump supporters, Trump got elected, and their feeling is now, I don't really have to worry about the ACA, or I can kind of cruise it out until January. And, you know, and then it might just be replaced. I don't have to worry about it anymore.
Yeah, I mean, that's a good question, too. I think the key message that we got from this election is that nothing is certain. And while there's certainly been a lot of, you know, politicking on the idea of repealing the law in its entirety, there's a lot of steps that need to take place between now and then. And, you know, if it becomes apparent that the law does not get repealed or does not get repealed in the form that we think it's going to get repealed, you don't get a do-over. In other words, you don't get to stop offering coverage in November of 2016 and then in, you know, February of 2017 say, whoops, guess I should have been doing that all along, so just give me a pass on penalties for that stretch. You know, we have a lot of clients who are under active DOL audit or who are coming under DOL audit. There doesn't seem to be a high likelihood at all that many of those plan provisions that folks need to have in place will get repealed on a retroactive basis. So, you know, I think the message continues to be keep moving forward as if nothing has changed until something actually affirmatively changes.
And with that, I think you make a really good point with there. You know, so there's a potential for nothing to change for a year or 2 years.
Yeah, absolutely. For a long period of time, if at all. So, you know, I think, again, the most prudent course of action at this point is to assume status quo until we see otherwise.
And with that, I think the important point that you made about the DOL audit. So if things don't change for a year or two, and the DOL does audits over the next 12 to 24 months, and then fines employers, and then 2 years from now the law has changed, there's a very high likelihood that those fines would still be enforced, correct?
That's exactly right. And, you know, another important point I want to make, I was reading an article this morning about that reconciliation process where the Senate could effectively repeal portions of the law based on 52 or 53 votes. And one of the interesting pieces I read was that many of the senators who voted to pass that repeal based on the reconciliation process cast that vote based on the premise that it was never going to have any meaning because it was going to get vetoed. So I don't think you can necessarily ensure a party line vote where you can ensure that all 53 Republican members or 52 Republican members of the Senate are going to just roll back this law without regard for the potential consequences, especially considering that a number of those individuals are going to be up for re-election in a moderate district in 2 years, and there is sort of a historical precedent that in off years, the party in power kind of gets slaughtered in congressional midterm elections. So again, just because there is this majority across the board doesn't mean that there aren't going to be fractions within the party that have different perspectives. I mean, and you saw that in 2010 when the Affordable Care Act passed. The reason why, President Obama and Congress did not just immediately pass the Affordable Care Act is because there were moderate members of the Democratic Party who were not on board with passing the law in the form that it was originally proposed. So you can't assume block voting in terms of how the Republican Party is going to proceed.
And what would you say? And I think you've answered this a little bit, but we have one question come in from Carlos, who said, like, as a broker, as an agent, if they're asked by their clients today, what is Trump getting in mean for me? What would be a standard, intelligent answer for them to provide?
This is not going to be the message that you're going to want to hear, but I think the message is we now, through, just being inundated with it and through participating in programs like the CRIS program, I think we all now have a fair level of comfort with what the Affordable Care Act is and what it means and what it works, and we have some familiarity with the measurement and stability period and how you determine a full-time employee. I think an election of Hillary Clinton would have meant more of the same, meaning no need to learn a bunch of new provisions. I think if the election of Donald Trump with a Republican majority in Congress almost guarantees there's going to be some form of change. We don't know what that is, but I guess the message is, get ready for more confusion and uncertainty surrounding how to structure your health benefit programs.
So a lot more fun for the upcoming year.
You might call it that.
So, and with that, as this moves forward, and there's going to be different proposed potential pieces of legislation from the Republican Party, different party members for health care reform for Trump to consider. Do you think that, the brokers, agents, employers should stay in tune as to what those rules and regs are and what's in there so they, have an understanding as they move through the process, one moves forward, what that is actually going to mean for them?
Yeah, I mean, I think one of the things that you always see in this space is that there is a premium for advanced knowledge and advanced certainty. In other words, when the Affordable Care Act passed, everybody wanted to sit down with somebody who knew how to talk about it and talk about what it meant. And then 2 years later, everybody kind of caught up. So I think the same is going to be true without a doubt here. I think the people on the webinar would probably say the same thing, right? Everybody wants to know today what this election means because you want to go tell your clients and you want to be the first person breaking that news to them. That's going to continue to be the case for the next, 6 months to a year as we see things unfold.
Thanks, Ben. So we're going to kind of wrap up our webcast. We're going to make the recording available to everyone who was on it, email it out to everyone else. We're going to continuously give updates through the Healthcare Reform Center and Policy Institute as we get any, just what we did as we did with the Affordable Care Act when that was originally proposed and passed. So please stay tuned. I mean, we've always been your trusted resource and the one place go to get the facts with no politics and no BS, and we will continue to stay committed to do that for you. And I want to thank you, Ben, for jumping on this webcast in, short notice. And I'm sure you got a busy couple days ahead of you.
That's an understatement.
Everyone, take care and have a great week.